Greetings, Rotary family, and welcome to the new Rotary year. I'd like to take this opportunity to thank all of our 2024-25 Rotary leaders at the club, at the district, and at the regional levels. I am grateful for your leadership and hard work to move our organization forward. As we embark on this new Rotary year, together, we can continue to work for peace, continue to find a balance between continuity and change, and focus on putting the 4 strategic priorities of our Rotary Action Plan to work. Increase our impact, expand our reach, enhance participant engagement, and increase our ability to adapt. By embracing these initiatives, we together will build a stronger Rotary and continue to do good in the world. Under the leadership of our new Rotary International President, Francesco Arezzo, we will unite for good as we create lasting change across the globe, in our communities, and in ourselves. President Francesco has said, "Let us create one great shared dream that unites us, that excites us, that changes the world, and changes our lives too." During the month of July, we also celebrate one of our 7 areas of focus, maternal and child health. As we engage in programs to save mothers and children around the world, I took the opportunity to interview past District Governor Connie Sparks from District 7390 in Pennsylvania. I hope that you enjoy her story about working with families in Zambia. Hi, Connie. Thank you so much for joining me today for a little bit of a conversation about maternal and child health. I appreciate it.
It's an honor to be here. Thank you.
Yeah, you're welcome. So, Connie, I understand that you've been involved with a number of Rotary Foundation global grants that focus on maternal and child health. Can you share some details today about your most recent medical grant to Zambia?
Yes, I've done about 28 medical missions all over the world. So we've done, of course, always concentrated trading on medical in all the areas, but children, mothers, pregnant women are always the last to get their help in these countries. And for many of them, uh, many of the countries, the average age is 14 or under because it's hard to survive with disease and all the other things that they have to face. So we have always put in a very large area of the doctors and nurses to work with the children, with the pregnant women, because many times they come in all by themselves with no one to help, no one to give them any information. They don't know what's wrong. And so it's very important to do that. And the children sometimes walk miles by themselves to come and get help for having, because they can't see or they have, pains or they have something. So maternal health and children are, I feel like, many years, not just prenatal, but all the way up to teenagers till they can somewhat fend for themselves, and they can get some medical care which they would never get if we didn't come.
Wow, 28 medical missions. That's incredible work, Connie. I don't know how you do it. Can you tell us a little bit more about who participated in executing that project in Zambia?
Yes, that was a very big, wonderful project. Okay. We were able to raise over $250,000 in grants from all over the world. Okay. There were 53 team members and from 11 countries, 7 Rotary districts, and 26 Rotary clubs. So we have, over the years, gained more partners. One of the things I've learned about this is that if you serve in Rotary, you don't quit. Okay. You understand the need and the camaraderie and the goals of Rotary International, and it actually builds. So we keep our partners, they don't go away. And so we just continue to add so that we can do more, because we did over 3,500 people in Zambia last year. And we opened up a new hospital that had been empty for a whole year because they had no doctors to come. We train every morning. We train for several hours. And when you train and you just go away, they don't keep it. So we train, and then the rest of the day they have to work with us, and they have to diagnose and implement and work right with us for the whole entire time. So when we leave, they actually do understand what they've learned during these training sessions for the vocational training team requirements. But when they go back, they take that, what they've learned, and they go back and they actually share it with everyone at their hospitals, because some of the people coming on our team are not, Americans. So we have doctors coming from Zambia, but we have doctors coming from Uganda, and they've been on our team 4 times. So we continue to train them, put them on the next team. They go back, and everyone at that hospital can't wait for them to come back so they can learn something new.
I'm so glad you mentioned all of the partnerships and the team members that you had. You know, we've seen in Rotary what a significant difference we can make when we establish those strategic partnerships. We can do so much more with them.
And
So,
isn't that what Paul Harris said? Her,
absolutely, you're
one
right.
person can do something, but what's going to get done is with many hands.
Absolutely, absolutely. So, Connie, can you share how you feel this grant was sustainable and what you think the long-term benefits are to the beneficiaries?
Well, we always work through the government as well, and, get all the credentials approved and everything. So you're making inroads for other teams to come. Okay. So once you can show that you came and you really produced a really great program for the community, and you involved the local people, the doctors and nurses, but also the government people who actually a lot of times have the last say in whether or not you come or you don't come, or whether they'll assist you in getting the people to you when you need to. So that's very important. And so that makes it more sustainable for the next team and for us even to come back again several years later. But it also makes it sustainable for the doctors, because when they learn, um, they want to share that knowledge with other people. They want to know that they're accepted and that everyone approves that they did get that training and they can help.
Sounds like the training and the education goes a long way in making our project sustainable. Yeah,
Very much. They want
good.
to learn more. They can't wait till the next mission. When are we going again? Because I want to learn more. The doctors will always say, we learned more in 10 days than we learned in our whole years in Africa or Brazil or whatever, and so this is so important for us. And they leave their homes like we do, meet us in the country, and they continue their learning. And so I think it's sustainable in that way. It's also sustainable for the communities, because once they come and they see you really are going to treat them, you are going to help them, you're going to give them medication. They don't even have an aspirin. So if their child has a fever, they don't have an aspirin. So they'll wait in line all day for an aspirin. Okay,
Right.
so I think we build trust. We help the local Rotary clubs. The Rotary Club in Mafui was 9 men, okay, and 1 woman, and they were tremendous partners. So you make those international partners, and that keeps rebuilding Rotary in these countries where it's harder to belong.
Well, Connie, one last question for you. What would you say the overall impact was of this program?
I think that not only for them, but for us, it was inspiring, educational. We have such an international group as it is, with all the countries involved that go every year. But to learn about our fellow Rotarians in other countries, the people that we can help and what their needs are, I think is what keeps everybody coming back. We want to help. Uh, we'll learn their circumstances. They'll learn to trust us, and that will help everyone in Rotary when they do these projects, because it can't just be one of us a month, one of us a year. We have to do more until they have more education, until they have more services. till they can open up a hospital and have enough doctors and nurses, to see the patients. Because there's certainly, when we get there in the morning, there's 600 people waiting. So there's certainly a need.
And all this great work that you're doing, the people's lives that you're affecting, I think it really speaks to our new presidential message for this year, which is Unite for Good. And so much that we can do together when we unite. So, Connie, thank you again for joining me today. It's been great having this conversation and learning more about your great work and your medical mission trips and your global grant projects. So, thanks for your great work and really appreciate it.
And thank you, Director Chris. Thank you very much.